really obviously focused today on hopefully your interest in becoming a governor with Northamptonshire Healthcare. And we'll tell you a bit about what the role involves and talk you through and obviously answer any questions. So just to introduce myself today and introduce other colleagues who are on the call who are sort of leading the presentation, if you like. So first of all, my name's Krishni Waring. I'm the chair of the trust and I chair the Council of Governors. So that's why I'm obviously here. But Richard, do you want to introduce yourself as well?
Yes, Krishni. Sorry, I got confused. So
Oh
Richard
yes,
Smith.
which Richard? We've got two Richards. So Richard, you start as you're here, Richard.
Okay. All right. Yes. So my name is Richard Amponsa, and I'm the staff governor for the staff nurse constituency. Been a governor since I think May 2022. Tracy, am I right?
Yes, 2021,
Yeah.
I think it is now.
Actually,
2021. Oh wow,
even
gosh.
longer. Yeah, there you are.
So you're welcome.
Lovely. We'll bring you in, Richard, to say a little bit about your experience, but the other Richard then as well.
Thanks, Krishni. Good evening, everybody. I'm also Richard Smith, and I'm the Director of Corporate Governance here, which means we work very closely with governors and also with board members. So should you become a governor, we'll be working very closely together. Thank you.
Thank you. And Tracy?
Hi, I'm Tracy Davis. I'm the lead for members and governors. So I work quite closely with the Council of Governors on a day-to-day basis.
Lovely. And I think that's it for the team that are involved in the presentation. So welcome to everybody. And we've just had somebody else join. Is it Eric or is it?
That's Eric, yeah. That's
Eric. Hi,
yeah.
Eric. Welcome.
Thank you.
So we've got a number of people on the call, and what we're going to do is put some slides up, I think, Tracy, aren't we?
Yes, just bear with me a second.
And then we're going to run through those slides, but obviously we really want to encourage you to interact in this session and ask us as many questions as you'd like, and we can hopefully explain what being a governor is and the kind of opportunities it might present. So I can see we've also got Adrian joining us as well. So welcome, Adrian. We're just about to kick off explaining a little bit about what being a governor is, and we were just saying that we really welcome the opportunity to answer any questions that people might have. So if you want to come in, either raise your hand if you know how to do that on the via Teams, or wave at us if you happen to be on screen, or turn your mic on so that you can speak, and then hopefully I'll spot that you want to come in and I can bring you in. So Tracy, shall we just run through the aims for today? So you can see there are 5 key things we want to do. We want to just tell you a little bit about the role and what's expected. It's obviously not going to be a huge amount of detail today. We'll cover off as much as we think it's reasonable to tell you at this stage, but there's one of the things we'll be telling you more about is the fact that we hold an induction event so people can come up to speed with everything that's involved. We also want to talk through with you how governors work within the organisation. So we'll explain a little bit, try and bring it to life a bit so you can try and visualise what governors do in NHFT, which is the name of our organisation, and I'll explain a bit more about that. We'll tell you what the vacancies are, because they are in specific places around Northamptonshire and the rest of England constituency as well. And patient service user as well, and a bit about the election process. Obviously answer as many questions as we can, and tell you about how you can access further support. So that's the plan for today, and hopefully it will give you everything you need to decide whether you want to stand for election as a governor. Okay, so Tracy, next slide please. So we've mentioned the name of our organisation, which is NHFT, a couple of times. So that's Northamptonshire Healthcare NHS Foundation Trust, and we always call it NHFT because that's a bit of a mouthful. But basically, it is the county-wide provider of mental health and community healthcare services. And we provide services to adults and children. But a lot of our services are delivered in the community. What does that actually mean? So that could be in people's homes. So community nurses who actually visit people's homes, or physiotherapists. It could be services that are actually delivered by us, but could be in one of the big acute hospitals in the county. It could be on our own sites, which are predominantly in Kettering and in Berrywood, in Northamptonshire, well, in sort of the Northampton area. But we do have facilities all over the county, and so a lot of our staff are spread out across the whole county. And we also have specialty services like prison healthcare services, which are actually further afield than Northamptonshire. So just really a very diverse range of services, and different. So I think important to say, we're very different to the organisations that run the two big acute hospitals, which is Kettering General and Northampton General. We do have hospitals, but they don't have A&Es and all the other things that most people are used to. They're more community hospitals for things like rehabilitation, and then mental health hospitals for people who are very unwell and need to be in an inpatient mental health setting. We're rated outstanding by the CQC, so that's really positive. And we're really proud of that, and we're proud of that for our staff. Obviously, it's quite a lot of hard work to try and keep a trust outstanding, and we're really looking for governors who can help us with that, and we'll tell you a bit about ways in which you can support us. And everything we do is about sort of really trying to put patients and our staff actually at the centre of our focus, and trying to think about how we make a difference for the community and for the patients we serve. And ultimately, our aim is to be a leading provider of outstanding, not just outstanding from a CQC point of view, but a compassionate service that really looks after the people and patients that need us. We employ approximately 6,000 staff, and we have nearly 9,000 or 8,000, I suppose, if you round it down, members. And members are hopefully people like you, actually. I don't know whether you're all members, but you may, many people become members of our organisation. And if you're a member, you can become a governor. Tracy can say a bit more about that later on. But it's the members who vote for governors, and membership gives you the opportunity to stand for a governor, but also just to learn about what we do and find out more about our services. So do stop me if there's anything that you want to ask, but otherwise we'll move on and come back to any questions that you have. So let's just talk about what is a governor. So first of all, I think it's important to say it's a voluntary role. So it's not a paid role. It's very much done as a volunteering, but interestingly, it's got some very specific legal duties associated with being governor. So I don't know if any of you have ever been a trustee, for example, of a charity. So in many ways, you could sort of equate being a governor a little bit like being a trustee, where if you're a trustee of a charity, you do make an important contribution to the governance of the organisation, but you do that as a volunteer. So that might be a helpful way of describing it. But a governor does two things. One is to hold non-executive directors to account, So we'll tell you a bit more about what does that mean when we describe how you can undertake the role, but it also represents the interests of members. These are the 8,500 or so people that register as members, as well as the public, and help us to make decisions that take their interests into account, really. So we'll talk a little bit more about how you do that, and give some examples of that. But those are the two big sort of statutory duties of governors, and they are very much, one is very much about sort of governance, if you like, and the other is all about representation. And being a representative is, in our case, being a representative of patients and carers, members of the public, staff or partners. And you can basically stand for election in any of the first three categories, so patients and carers, public or staff. And again, we'll tell you a bit more about that as we come to the detail of the seats that are available. But the important thing is that we have a board of directors, but we also have a council of governors, and the council of governors is the group to which you will belong, and that group provides, as I say, an additional role around governance within our organisation, and it's being part of that collective group of governors that really gives you the power, if you like, to make certain decisions on behalf of the trust, and things that we come and consult you on to make sure that we're taking into account the needs of our community and all the groups that are mentioned there. Okay, so hopefully that gives you a kind of bit of an overview, but we'll go into a bit more detail now, and I'll take the opportunity to bring other colleagues in to give some examples of what this involves. So what does all that actually mean in practice? What do governors actually do? So we've touched on the duties. They hold the non-executive directors to account for the performance of the board, and governors have a duty to represent the interests of the members. So we touched on those already. So first of all, there is mention there of appointing, and if appropriate, removing the chair and other non-executive directors. So Richard Amponza, can I bring you in here? Because Richard, I think you sit on our Nominations and Remuneration Committee, don't you?
Yes.
And do you mind telling colleagues who are interested in becoming a governor sort of what things that you've been involved in as part of that, being a member of that committee?
Yeah, so specifically for that committee, as the name suggests, we are involved in discussions and decisions on who joins the board. So, for example, I was involved in the recruitment of our associate nets. So going through the stakeholder panel meetings and discussions, and I'm not sure I was a member of the panel, but those are some of the things you get the chance to be involved in, reviewing the CVs and deciding, sitting on interview panels, deciding who to appoint, who not to appoint, being part of all those discussions. And these are obviously people who are very accomplished in their own right, in terms of their fields of endeavor. So we're talking about people from industry, from private and public organizations. So they're just a breadth of experience, and being part of that is so revealing. And so, it provides lots of opportunities for the people that are involved. I can speak for myself in terms of the exposure and what you learn from it for your own personal and professional development. So the opportunities for me have been just endless. I've also had the opportunity to be involved in recruiting the organizations that are responsible for our exec recruitment. So I've forgotten the name of the company, Krishni.
Yeah,
Anderson
Quigley.
Anderson
Quigley, wasn't it?
Yes, exactly. So just that whole engagement process of how they work and how us being able to assess and interview them and whether they have the right and proper company to help us to recruit for these top talents. So you learn a lot through that. We've also been involved in discussions on extending the contracts or the tenure of office of some of our NEDs, Krishni being one of them, because as you know, Krishni holds a dual role with us and with LPT. So, I mean, and I was saying to Krishni the other day and Richard that if I was to just find one word to describe what it means, I would say exposure. It's just exposes you to so much, and you just come away with such rich knowledge and information that you wouldn't get elsewhere. So I would really encourage the guests on this call to really consider seriously becoming a part of the standing for election. I mean, I'm due to stand as well, so in a way, I'm giving away my trade secrets, which I shouldn't be doing. But that is how encouraging and inspiring it's been. So I'd encourage you to do that. Yeah.
Thank you. And Richard, I mean, just so everybody, I know some colleagues on here might be thinking about becoming a public governor, but I can see, for example, Mo is on here, and I know Mo is a member of our staff. So it's obviously slightly different for some, for staff as opposed to members of the public. But I think, as Richard said, for members of staff, it's a great development opportunity, great opportunity to get to know the board a bit better, get to know how things work at organisational level as opposed to at service level. But also for members of the public who may have never been involved in something like this, I think it helps people to understand how the NHS operates. It helps people to find a different way of contributing, because you could, and we'll talk a little bit more about other opportunities there might be that aren't about governors. For members of the public, there are other ways you can become involved in the NHS that isn't being a governor, but certainly being a governor, I think, gives you a different level of connection, because you'll hear regularly from the chief executive, you'll hear regularly from members of the board, you'll hear from partners who work with us who are also governors, and there'll be lots of updates about what's happening within the trust at sort of, I suppose, organisational level. So Richard has given you a really good example of how governors get involved in appointing and removing the chair and other non-executive directors. And actually, if you think about that, that means, governors are effectively deciding who is a member of our board. So it's a really important role that governors play. Of course, we support you with all of that, and we kind of help you to understand all the processes. But it's a great opportunity to really influence what happens at board level within our organisation. Now, there's a whole set of other things there in that list. Some of which don't happen very often. Certainly in our organisation, we've had the same chief executive for quite a while, so you don't get to, obviously you don't get to appoint the new chief executive unless the current one leaves, so that hasn't happened for quite a long time. But there's certainly things like being involved in appointing an external auditor. Richard Smith, do you want to mention a little bit about what that is?
Yes, of course. So many of you, I suspect, will be involved in other organisations, but the principle of an external auditor, as the name really suggests, is somebody that's not involved in the running of NHFT, that provides an independent view on how we're doing. And it's not just focused on how we're managing our money, although that is a primary focus of the auditors. It's also looking at the quality of care that we provide and whether we're actually following the relevant legislation and statutory guidance. And there are two types of auditor, an internal and an external auditor. And slightly confusingly, our internal auditor is actually provided by an external firm, but we won't worry about that here this afternoon. The external auditor is a really key position for governors, in that governors have control over who is appointed as the external auditor. It's a key duty, as you can see here. So you are involved in the process, supported by our procurement team in running a procurement process to identify some candidates to become external auditors, and then bringing the preferred firm on board. And you then will receive reports from the external auditor at the end of every year, and you can consult with them in the meantime if you wish to do so. And then we'll give you that really independent source of assurance or evidence really of how the trust is performing, which will support you in what we were describing previously in holding our non-executive directors to account. So it's really quite an important role, but rest assured, actually, you're not going to be left alone to find an audit firm that could work for the trust. We will support you with that, we being the corporate governance team, but also our experts in procurement.
And I think it's just worth sort of saying really that the roles like the non-executive directors, the auditors, all of these things are about good governance. They're all about making sure you have the right structures in place so that the organisation is properly run. So what governors are providing are help, really, and extra support to make sure that the right sort of people and the right sort of companies are involved in making sure we are doing the right things. We are, running our organisation well. We're doing the best that we can for our patients, using public money appropriately, all of those things. So that's what auditors give you assurance about, and that's why it's important that governors are involved in that. And then the other two things points 6 and 7 are quite technical, don't happen very often. So I'm not going to spend a great deal of time here on those. But if we were ever to consider merging with another organisation, governors would have to be involved in that. But more likely, the couple of things that you would do are to receive our accounts and get a report from the auditors, as we've said, because that annual process is a really important one to provide assurance to the public that we've done the right things with the budget that we've been given. And also, every year we refresh our plan for the following year, and part of what we do is then ask the governors to give us some input onto what that sort of focus of that plan should be. And actually quite recently, probably a couple of weeks ago, Richard, I think we ran a webinar which involved governors and members to contribute to talk about really what we were thinking about in our plans and any thoughts and ideas that they might have to provide. So hopefully that gives you a kind of sense of some of the key duties that governors are specifically involved in. Tracy, would you mind moving it on, please? So what does that, again, we're trying to sort of take you a little bit each time into a bit more practical information. So there are some, words on a page saying here are the sort of technical duties, but this slide brings a little bit to life on how you do these things, because otherwise it might sound a little bit sort of, I suppose, a bit broad brush. The main thing is attending councillor governors meetings. So we have 6 meetings a year. And those meetings are the most important thing that governors need to do. And it doesn't matter whether you're a member of staff, are you a staff governor, a patient governor, a public governor, or a partner governor. The one thing everybody needs to do is attend the meetings. And we'll tell you a bit about, we'll give you the dates of those meetings, because it's really important that you have a look at those dates and make sure that you can attend them. Otherwise, to be honest, it might not work, you standing as a governor. But we'll come back to that. There are lots of other things that you can do. A lot will depend on how much time you've got, how much, what sort of your ways that you like to contribute and get involved, really. So some examples, we have something called a membership and representation group. So Tracy, do you want to just tell colleagues a little bit about that group?
Yes, so this group gets together about 4 times a year, and it will discuss, it sort of sets the membership priorities they want to focus on. We'll discuss those priorities, and governors can come together and how they want to help achieve those priorities. So we encourage all governors to attend those because it's about representing the membership. So we hold those about 4 times a year, and it's open to all governors. So and we've actually got one coming up next week for our current governors. So we're going to be discussing what we did last year, setting next year's priorities, and we're also getting feedback from a governor who's attended a training course. So she's going to feed back to the council of what she's learned. So that's the type of things we discuss at that meeting.
Thanks, Tracy. And that one is optional. Okay, so unlike the Council of Governors, which you really have to attend, the membership and representation group is optional. But obviously, you know, it's interesting to be involved in one of the additional groups around, apart from the actual council itself. But other ways you can make, you know, contribute, you can observe trust board meetings and give some feedback to the Council of Governors about what you saw. You can attend meetings between the Council of Governors and non-executive directors. We often do things like what we call constituency meetings, which you know, help you to think about with the non-executive directors how we can meet the needs of our local population. You can give some feedback to non-executives in terms of their appraisals. You can help with recruitment, as Richard and Ponza mentioned. You can ask questions of the board when the board is members of the board are attending the Council of Governors. There's, you know, we run webinars for members, so you can participate in those. And there's also a members bulletin, which some of you may have seen, which you know, governors can contribute to. So there's a whole range of different things. We genuinely don't expect you to be involved in everything, but we certainly need you to attend the Council of Governors, and we encourage you, I think, to get involved in as much as you can do, because obviously that makes the role a little bit more interesting, and you'll learn much more about the organisation and who we are and how we work, the more that you get involved in different activities. So Richard Smith or Tracy, is there anything else that you want to add on that slide before we move on?
No, I think you've covered it well, actually, Krishni. Thank you.
Thank you, Tracy. Anything else you want to add?
Yeah, you mentioned it, but I forgot to update this slide. But the NED Governor Forum is now called a NED Governor Constituency Meeting, which you mentioned. But it was just to say we've actually split those by North and West Northants to align sort of the local authority areas. So depending on where you live, you might end up in one of those 2 groups.
And I think, isn't there now an opportunity to get involved in one of the, is it the local area partnerships in the north, is that right?
It is correct, yeah. So we've got Ketchin and Corby local area partnerships are open for governors to attend as well if they wish to do so, and we have got at least one governor going to those currently. Yeah,
so there's sort of lots of things really that mean that you can get involved in kind of understanding a bit more about how health services are being designed and developed within Northamptonshire, particularly in obviously split across west and north, but there's all sorts of other things like using your own networks to sort of think about, you know, how you can get views on different things that we need to do from a health point of view. So it's a really good opportunity to use it, if you've got those networks, to contribute to the trust strategy really on behalf of the people that you represent. So thank you, Tracy. Should we move on to the next slide? So the kind of really absolute minimum that you need to do, and these are sort of probably really the most important things. I've already mentioned committing to attending 6 formal meetings a year. There are several other workshops. Almost all of it is virtual, but not everything. The induction, for example, we'd like to do face-to-face because we found that helpful. And there are other meetings that we hold face to face, but we do a lot of the kind of core meetings virtually. You will get sets of papers because these are formal meetings, and there are reports and things like that which you will need to read, and we'd ask you to read them and try and familiarise yourself with them and be able to contribute really in meetings to talk about the reports that have been provided or ask questions, and if where you are representing a particular constituency or you're working with other colleagues, we want you to be able to sort of bring in those contributions into our conversation. We obviously need you all to work together. So we've got a real kind of mix of people on our council. So we really need you to take responsibility and be involved across the whole council to work together, and we also need you to sign a code of conduct. So those are some of the core expectations of a governor. In terms of support, Tracy, do you want to touch on some of these?
So we've mentioned that you will get an induction, which we are planning to do in person. That'll be the plan to do that on the 16th of May. So that might be an important date for you to note now. The venue's likely to be Kettering, but that's still to be decided. We do provide ongoing training and development, and that can be both formal and informal training. So we will help support you. There is an element of mandatory training, although those who are staff governors will be glad to know that you don't have to do it twice. So it's the same similar training to training you've done in the trust, so you won't need to do it again, but we would ask our public and patient care governors to undertake some mandatory training, and that'll be things like information governance, so some sort of key modules for you to undertake your role. We are always on hand to answer any of your questions, as in the team, so if you've got any questions, and that includes at this stage sort of pre-election as well, if you've got any questions. We will offer to buddy you with a more experienced governor if you wish to take that up. So someone who's done the role for a while that you can go to ask questions. And we do pay travel expenses for meetings that are face-to-face. So that is a lot less these days now. We're a bit more virtual, but that is still there for people if they wish to claim expenses.
Okay, lovely. Thank you, Tracy. Richard and Ponza, is there anything else you want to add as a sort of to kind of bring the governor role to life? I know you contributed earlier to say that you were sort of, you thought it was all about exposure from your point of view, but is there anything else, Richard, you'd like to contribute to just to sort of raise people's understanding of what being a governor has been like for you, because you've almost done 3 years now, we've established, haven't you?
Yeah. I'd say, networking and building relationships and connections has been really, not just with people within NHFT, but also especially across other organizations. And one of the responsibilities of the governor is, representing the interest of members. And I remember the discussions we had around COVID time and the cost of living increases and the pressures on staff, and some of the things that the trust did to try and ease the burden on our staff, like for example increasing the mileage, and other support. So all these things are discussions you have the chance to be involved in. So it has a direct impact on the constituency that you support. And I was very happy to be involved in those kinds of discussions, because obviously being a nurse by background, I knew what the pressures are. I've worked in the community before, so I could understand that. So bringing those discussions to bear for me was really important. And also it just enhances you as an individual, because you have the chance to sit in the private meetings as well, and we discuss things that are really key to the health and well-being of individuals, and just having the chance to contribute and just to bring that whole empathy, speaking as a mental health nurse, and of course as a nurse, just bringing all that to bear on the discussions and having the opportunity to shape those discussions are just things that you can't put a price on. So yeah, for me it's been an overall very highly educational, informative. You mentioned the webinar, for example, that we had recently. Just having the chance to listen to people who've been involved in working on refreshing the trust, Dig BQ strategy, and just presenting it like that in bite size. I just took a lot away from it, and it gives you a view of the organization that you wouldn't have in any other forum. So, yeah, for me, it's been a very, very good learning experience, and I continue to learn, through my involvement with these activities.
Thank you, Richard. That's really helpful. And as I say, Richard's obviously illustrated where he's been able to represent his sort of, if you like, his constituency, which is obviously members of staff, but equally we've had sort of perspectives raised by members of the council on our mental health services, or how we engage or co-produce our services with patients. I think recently we had a public governor who, along with one of our staff governors, got engaged, got involved or met our youth advisory board, which is a group of young people. So, that there are different ways in which people can contribute, and I think it's really important that we illustrate those. So whether you're a staff governor or whether you're a public governor or a patient governor, you can bring a perspective from your experience to bear, which is really helpful and important to us as an organisation. So because we've emphasised quite a few times these meetings that are really important for you to be able to attend, we've actually put the dates on these slides. Now, Tracy, are we sending these slides out to people who've participated in today's event?
Yes, and we're also recording today, so the recording will be available for people to watch back if they want to go back and check what they've heard as well. But I will be sending the slides out as well.
Okay, lovely. So the key dates are these. They're the ones that people really need to be able to attend. And you can see that we try and vary the times so that it hopefully allows people the chance to make most of them depending on their own work schedules. What I will say is that doesn't mean you can never miss a meeting. So I don't want you to think it's completely impractical and we demand that you attend every single meeting. It isn't like that, but it is really important that you don't miss lots of meetings in a row. That's when it becomes a problem. So the odd meeting here and there is not so much of an issue, but missing 3 meetings in a row, that is about 6 months worth of input and discussion. So that's a lot to lose out on, and that's the sort of thing that we would be we would find difficult to accommodate, really. So it's really important that you look at those dates and make sure they are ones that in the main you can attend. So the next slide, please, Tracy. So this is quite helpful because, what if being a governor, because a lot about being a governor is in being involved with the board and being involved at organisational level rather than really at service level. And you're hearing about things that are happening across the organisation and about priorities and about certainly some things around services, and you get a chance if you want to make a service visit, but predominantly it's not really about being involved in specific services, and if that's what you're interested in, then there are these different options that you might want to consider. So you might want to consider being a volunteer, and that can sometimes use all sorts of different skills. I mean, the example there is gardening. We literally have people who come along and help us keep our gardens in check and have done some wonderful work in developing some of our gardens for some of our inpatient units, for example. We also have people who what we call our involvee. It is a type of volunteering role, but it's particularly somebody who helps to use their lived experience to contribute to how services are planned. It could include, involvees sometimes can, for example, get involved in a really practical thing, like if we're recruiting a consultant for a particular service and we're looking for I don't know, somebody who's been involved in a consultant who's a psychiatrist, then we often have involvees involved in the panels, and that's a great way of helping a service get the right sort of doctor into their team. But that it could also be in helping providing ideas about how we develop services. So that's what an involvee does. And then a peer support worker is actually an employee, but it's somebody, I mean, that does require someone applying for a role and using their personal experience, particularly of mental health condition, to work in mental health services providing support. And Richard Ampons has made a comment in the chat about the Martin's Crisis House in Rushden, and what a beautiful vegetable and flower garden that is, and how it's been tended by volunteers. And we have many examples, allotments that have been worked on with volunteers, which involvees have also contributed to. So it's been, there's a lot of amazing work done by people. So, and by the way, you could be a governor and a volunteer in other services. You could be a governor and an involvee. You could be, well, you can't be a peer support worker. Well, you could be, but you'd have to be a staff governor. So there are sort of, they are compatible as well. It's just being a governor has a very specific set of responsibilities, and we'd be keen to emphasise that, so you'll understand that that's the kind of thing that you'd be involved in. So what are the current opportunities? Tracy, do you want to talk us through this?
So we do have a number of seats up this time. We have 2 public seats in Northampton, which is open to people who live in the local authority area of Northampton. And then we've got 2 for Devonshire and South Northampton, so the same applies. We've then got 1 seat in the rest of England, which is basically anywhere outside of Northamptonshire, but in England. So that applies. Particularly, we've got a lot of neighbouring counties around here, and quite a lot of our services touch on the borders of Northamptonshire. So we do quite often get candidates from, say, Leicestershire, Cambridgeshire, those areas, and down sort of down the south as well, sort of down Brackley way and beyond. I know Brackley's in Northamptonshire, but we cross on the Oxfordshire border quite a lot down there. We've also got 7 patient and carer seats. So if you are a user of Trust services, or you've cared for someone who used Trust services in the last 10 years, you could be eligible either for the patient and carer seat or a public seat. You would have to choose which one, but you could be eligible for both. There are also 5 staff governor seats. Now, if you are a staff member, you can only stand in the staff seats, because I know that question did come up pre the webinar. So if you're a member of staff, you can only stand in staff, but other members of the public could choose between public and patient and carer, depending on their circumstances as well. And the other thing I was just going to say on the staff seats is they're no longer by job role. So we've just got 5 staff governor seats now. So you're eligible to stand. There's 5 seats available, so any staff member can stand. So we no longer split by, say, nurses or doctors. They're just 5 staff governor seats.
Thanks, Tracy. And that really means that anybody, really any member of staff, can stand in those seats. And it'll just be a matter of who gets the most votes. Obviously, there will be hopefully some existing staff governors who restand, but that's it's up to members to decide who gets elected. Tracy, is it worth just mentioning bank staff? What's the situation with bank staff?
Yes. So the staff seats also include bank staff. So as long as you're registered on the bank, and so if you're regularly taking work, you stay on the bank list, so you are eligible to stand as well. So it's standard staff and bank staff as well, because we do sort of acknowledge that some staff are on bank and do long-term work on the bank. So bank staff can stand as well.
Okay, lovely. Thanks, Tracy. So those are the seats. If we move on, do you want to run through the milestones and what you have to do then, Tracy?
Yes. So the first thing I'll just say is you do need to be a member of the trust to stand in the seats. Now, for staff, there's been a bit of a change this year, which you may have seen the communications about, that you are now automatically members. So staff don't have to worry because you're already members. if you are planning to stand in the public or patient and carer seats, you do need to be a member. Now, some of you probably are already members because you received the notice of election. If you're not, you will just need to sign up on the website, and there's a link on the slides to how you sign up as a member. It's a really quick form, so you just need to complete that, and you can do that alongside submitting your nomination. So the deadline for nominations is Thursday, the 29th of February at 5 o'clock, taking advantage of our extra day this year in our leap year. So you've got to the end of the 29th of February. And then in order to stand, there's a link there you'll see to the Civica website, which will take you through to the nomination form. So the nomination form will ask for a short sort of statement of why you wish to stand as a governor. We encourage candidates to provide a photograph in case it does go to a vote. So please do submit a photograph as well as your statements. If we then get more candidates than there are seats, it will go out to a vote. And you'll see from there that's on 22nd of March. So if it goes to a vote, it then closes on the 18th of April. The results will be announced on the 19th of April, and with terms of office starting on Monday, the 24th of April. And I did mention earlier that we're planning an induction on the 16th of May. So there will be some paperwork to fill in that period. But any seats that don't go to a vote, we should know soon after the 6th of March. We'll be in contact with you earlier, I should imagine. But anyone who's out to a vote won't know until sort of towards the back end of April or mid-April to later on. So that link is active, the Civica one. So that will take you to the nomination form. They do accept postal ones, but we do encourage electronic where possible, just because it's sort of quicker and easier, and hopefully you can upload a photograph that way.
Okay, thank you, Tracy. And what I would say is don't leave it till the last minute, just in case there's a sort of problem or something. So do try and get your, if you are deciding to stand, do try and get your get yourself in there early. And as Tracy said, ultimately, if there's a smaller number of people standing for a particular seat, then you may be elected uncontested and it doesn't actually go to voting. But obviously, if there's a competition and there's more than one person for each seat, then clearly a voting process is needed. So think about, what in producing your statement, think about why you want to be a governor and what you think you can bring to it. And I think that's helpful in perhaps people making a decision as to why, if it does go to a vote, they would vote for you rather than someone else. So hopefully that's very clear and straightforward. So it's really an opportunity now for any questions at all. If anybody wants to come in, please don't be afraid to ask any questions, because I know sometimes people think, oh no, I'm not sure I should ask that. It might sound a bit silly, but anything is okay, honestly, because we realise some of what we cover with these sessions may sound a little bit complicated. So if there's anything people want to clarify at all, that would be absolutely fine. So please do come in if you'd like to. Anybody want to raise a question? Jennifer?
Hi, it's Jennifer here. Good evening, everyone.
Hi.
Thank you for a lovely presentation. I think the question I have really is, I know you mentioned about the NED, so the non-executive directors. Is there a reason why it's only, because I know you said I say we, as if I'm already a governor, that you mentioned about the interaction is only with the non-exec, and then what happens to the? So I just wanted to be sure why that's in place.
Okay. Okay, so that there is it's sort of it's a really good question, Jennifer, actually, because so I think first of all, I think very generally you as a governor, you would be holding, if you like, your opportunity to question the board and engage the board will be available to you. So regularly, the chief executive, members of the executive directors, others attend the board, and as well as non-executive directors. It's just, I think, the technical sort of description is that you actually are responsible for actually appointing the non-executive directors. So you sort of use your power of appointing people to influence the board of directors. And that's the only sort of technical reason. The non-executive directors themselves actually appoint the executive directors. So it's a point of sort of technical governance, really. I don't know, Richard, if you want to add to that, in case I've probably not explained that very clearly. Richard Smith?
No, I think it was clear, Christy. I guess what I would say is that the way in which the governance model is designed is on a sort of stepped basis, really. So the people that run the services day to day are obviously the executive directors and the managers in the organisation. The non-exec directors are one step removed. So they don't have day-to-day responsibility for running the service, but they're holding the execs to account for doing that. And governors are next in the chain of accountability, really. So they're a further step removed from running the organisation. And that's why they're really seeking evidence from the non-executives that they've asked the right questions of the execs to make sure, as Christian was saying earlier on, that we're running good quality services and using public money effectively. And then ultimately, the members of the public and members of the trust hold governors to account for what they're doing. So it's quite deliberately structured in that way to avoid any confusion between individual roles. And actually, it's a slightly stronger governance model. But as Christian says, that's not to say that you won't ever see an executive director or member of staff. You will certainly see a lot of them, but your primary relationship would be with the non-execs on the board.
Is that okay, Jennifer? Does that kind of make sense? And is there anything you want to come back on, just to check that covered off your question?
No, that actually did. Thank you, Richard. Richard Smith. Yeah, I was quite visualizing it because I'm a visual learner. So the way you've actually described it was really good. Not saying that, Christian, you didn't do the same, but
I definitely didn't do as well. I don't think, Jennifer. I think Richard explained it much better. And to be fair, Jennifer, I think it's one of the things that we'll probably go into in the induction, because there's a really good picture that we use that sort of explains that. And in the absence of the picture, I think I was struggling to remember how best to explain it. But yeah, so there are these sort of layers of governance, if you like, or steps of governance, as Richard described. So, but it is important to say that as a governor, you do get, you will often see the chief executive, probably. As many, certainly the chief executive or the deputy chief executive, every meeting. One of them actually attends every councillor governors meeting. So it's really important that you get that access. You'll meet a lot of executive directors, but the primary connection is with the non-executives who you will hear from and see a lot, and probably a lot more, because they'll be just attend more meetings with you, that sort of thing. And that includes me, by the way, just so you're clear. Although my title is chair, I am a non-executive director. You do appoint me as well. You make decisions about me as well. And the reason for that is because although I chair the vote of the board of directors, I am, I'm also not employed by the trust. I am a non-executive director. And again, these are points of detail that we'll go into a bit more if you're successful and as part of our induction programme. But a really, really good question. So thank you, Jennifer. Anybody else wants to come in and ask anything? Anything else at all? Hopefully the role that we've described is clear. Has anybody, I mean, not that you have to say, but does anyone quite like the idea of being a governor, or, anyone want to say anything about what they've heard, even if it's not a question specifically? No, we kept you quiet then.
Not really. I just I'll let Eric go. Eric go.
Go on then, Eric.
Yeah, I currently don't have any ideas of becoming a governor, but I just wanted to join this platform just to know who the governors, what the governors do and everything. But I think Richard's explanation and contribution has given me like a bit of very wide introduction to it, and also as a staff, what I will gain from becoming a governor. So I'm thinking about it. So I know Richard, so I'll meet Richard tomorrow. Then probably we can look at it more, and then I'll see. Yeah, something I'll think about.
Yeah, absolutely. Please do have a think. You know, it is a commitment, but it's also really great, I think, for staff in particular. I think it's a great development opportunity, as I think Richard explained, and it just gives you a different perspective about the organisation. I think not to say you can't get that perspective from being a member of staff, but clearly you're interacting with the board more regularly and with non-executive directors in particular. So I would absolutely encourage you. And if there's anything at all you want to talk about, you want to ask us, here are, you can see that there are some telephone numbers, some email addresses, there's some website information that you can have a read in your own time. Anything at all, please ask. We will send you the slides, and if you look at them and you think, oh, after the event you think there's something else you wanted to know, then don't hesitate, because we want you to feel equipped as much as you can be at this stage in the day. But equally, we will recognise there's a lot to learn when you become a governor, but that's part of the development journey that you go on as well. So hopefully that's been really helpful. Thank you, Greg, for your feedback as well. And well, I look forward to, hopefully, if some of you decide to stand, hearing about the outcome of the process, which I think the first results, as Tracy said, will be the 6th of March, and then thereafter in April. So is that okay, everybody? We've made it nearly to 6:30, so I just want to thank Richard Amponza in particular, because Richard obviously we roped him in to come along, and he very kindly agreed, and obviously thank you all for taking part and showing an interest in being a governor. So lovely to meet you all. I know some of you. I know Mo and others. I do know already. So lovely to see you. All right, everybody.
Oh, I think we might have a question.
Jennifer, yes, please do. Please come in.
Yeah, just thank you. Just quickly, maybe for future webinar, is it okay to maybe introduce what you guys do? Because I know you said officially you're a non-executive. It'd be nice to know what your backgrounds are, because I know, Richard, you said you were a nurse. I didn't know you were a nurse, but it was lovely to know that you were a staff. So maybe next time, just having an idea what each of you do is kind of really helpful, because I'm just very curious, really. more nosy.
And Jennifer, if you want to find out a little bit, I mean, just in the interest of time, I won't try and explain it here, but if you do want to see, you can go to our website, and certainly my background is on the website for everybody to see, so that, because we always like to be very transparent around our board members. But probably we can do some little bios in the future, can't we, Tracy? So maybe that's a little helpful piece of feedback. So thank you very much, Jennifer, for that. But do certainly check me out. I am on the website if you want to find out more about me. All right. Thanks very much, everybody. Really appreciate your interest. Have a good evening. Take care.
Bye.
Bye-bye.
Bye, everyone.
Bye.